who are coming from such poor families that they can never dream of becoming doctors. So around 5 years ago, we took a decision that we want 2,000 children from villages of West Bengal to become doctors. All they need to do is when they are 13-year-old, they should commit to us that they will become doctors. When they commit to us about their commitment to become a doctor, we give them a scholarship of 500 rupees per month and we mentor them. And these children work very, very hard. They join the medical college by merit, and I strongly believe one day these children will become greatest doctors because they have the fire in the belly to work for 18-20 hours and change the rules of the game. Next slide, please. One of the biggest costs your hospital is facing, our hospital is facing, every hospital in this country is facing, is we buy expensive CT scan, MRI, and cath labs. The manufacturers will service the machine only for 5 to 6 years. After 6 years, they will come and tell you that there are no components available and you have to buy a new machine. Our patients don't have the money to have the CT scan with that kind of a pricing. Interestingly, you are probably not aware that we fly a plane which is 30-year-old and junk a CT scanner which is 5-year-old. So we decided to tie up with a US company called TriMedics, which can maintain these machines for 14 years, so that next 7 years you have these machines free of cost. Essentially, we all dream of reducing the cost of healthcare. It doesn't happen automatically. We have to take steps to make it happen. Next slide, please. As doctors, you're all aware of our practices. And in the end, whatever you do, who pays for it? It is ultimately the patient. So I want to ask you a question. Which is the most expensive medical equipment from the patient point of view? Do you know which is the most expensive medical equipment? It's your pen. Half the investigations you prescribe, you don't bother looking at it. Half the medicines you prescribe, you don't even know whether it acts or it doesn't act. So if you try to be more conscious that whatever investigation you write, somebody would have sold their house or their whatever they have and pay for it, next time when you write, you will be careful. So remember, the most expensive equipment in medical field is your pen. Next time when you use it, be careful. Next one, please. We don't really try to evaluate how safe is the hospital. We always tell the patients, okay, you have a problem at home, come to the hospital, we'll take care. But believe me, hospitals are not very safe places for the patients. American hospitals are the safest hospitals on the earth, but even they are not very safe for the patient. This is the photograph. I'm not sure whether you can recognize. This magazine was published 50 years ago with the beautiful face of Jacqueline Kennedy, Kennedy's wife. And the lead article says that our hospitals are killing us. Americans are complaining that hospitals are not safe for the patient. One would have thought Americans are a rich country and they have many systems. They would have addressed the problem of hospital safety. Next slide, please. In 2008, that is 50 years later, still American hospitals are not safe for the patient. What it says there is 1 in 200 patients, when they get admitted to the hospital, they die due to medical error. 1 in 200 people dying not due to disease, but by the error in the hospital. It is not medical negligence, it is medical error. Getting admitted to American hospital is 10 times riskier than skydiving. Why is that? What is the reason? The reason is we doctors don't like to follow the protocol or policies. All of us have our own way of treating patients, like every housewife has a recipe. We don't follow the policies, we don't follow the protocol. Next slide, please. But things are going to change. Soon, there will be softwares which will make smarter diagnosis than us. I know you may not like to hear, but that is going to happen. Next slide, please. Within 10 years, it will become legally mandatory for all of us doctors to get a second opinion from the computer before starting the treatment. This is the reality. Sooner we accept, better for us. Nobody can come on the way of change. Now you must be thinking, how can a computer be smarter than us? Look at this slide. Next slide, please. Can you see that? Chess champion Garry Kasparov, one of the world's greatest brains, he was beaten hollow by the computer in the game of chess. If computers can beat Kasparov in a game of chess, we are nothing. Next slide, please. Why all these changes didn't get converted into better practices in the hospital? It's mainly because of insecurities of professionals like us. We believe that nobody can tell us how to do things. Next slide, please. This is I just want to tell you that we have policies in our country that when a hernia operation or a heart operation or a gallbladder surgery is done, the person who hands over the surgical instrument has to be BSc in nursing. It is a local legal requirement. Anyone else cannot hand over the instrument. I just want to show you this picture. This is a beautiful picture in my office. And this photo is so attractive. Anybody entering my office, they ask me who the painter is. They think it's a great painter. Can you think who do you think was the painter? I get the names like Michelangelo or M.F. Hussain. This painting is done by a trained elephant in Thailand. If we can train elephants to do this painting, can't we train village girls to hand over a surgical instrument when we do a hernia operation? We can. But our professional bodies will not allow that. And that is the reason why healthcare is accessible to only 9 to 10% of the world's population. These things have to change. If doctors are like us, if we don't make these changes, the society will force us to make changes. And when the society takes it as a task, we will have a very unpleasant task in hand. Before they react, we react and change these things. Next, please. Every change in the world is interlinked. Cost of healthcare in US will not come down unless they help us to reduce the cost of our healthcare. Now you must be wondering, what is the relationship between US and European healthcare to our cost? Next slide, please. Why do you think in US today, mobile phones are so cheap that everyone can buy mobile phone? Why? Because, next slide please, 900 million Indians are buying mobile phone. We give the volume to the mobile phone companies and they can reduce the price in America and Europe. When we start buying medicines, CT scanners, cost of everything will go down. Next slide please. As doctors, you all aware that we are an Indian degree holder, and if we have to go to US, Europe or anywhere, we need to pass their entrance exam, which can be at times very humiliating. But things are going to change. Around 3 years ago, government of Cayman Island, one of the richest countries, approached us to set up a large hospital in their island, which is very close to US. And we told them that we can set up a hospital in your country, but we have only one condition. Do you know what that condition is? You recognize our degrees. Then we will set up the hospital. They had all kinds of excuses. They went back, consulted their experts from US and Europe. In the end, they agreed to recognize our degree. And Cayman Island is the first government in the world which has recognized Indian degree after Indian government. Believe me, it is a matter of time. Our degrees will be recognized in US, Europe, all over the world, because we produce some of the smartest doctors in the world. Nobody can, it is not easy for people to match our skills. Next slide, please. This is my last slide. I have to catch my flight. I believe that by year 2020, we will become a superpower. We will not become a superpower by producing weapons of mass destruction. We will become a superpower by dissociating healthcare from everyone. He is a professional like me. He is called Paura Karmika. His job is, when the sewage pipe gets choked in Bangalore, in rich residential areas where people like me live, his job is getting into the sewage pipe, clear the sewage pipe so that people like me don't die from leptospirosis or any of those diseases. But in the process, his lifespan is reduced to 45 years. He is the one who protects my life, but when he is unwell, we don't care for him. The day we care for a person like him, we will become a superpower. Why I am so bullish about my country that we are going to change the world? I am bullish because I just want to end my talk by giving an incident, mentioning an incident which happened about 3 to 4 years ago. 3 or 4 years ago, my wife was walking in front of a shopping mall. On the pavement, she saw one beggar sleeping there with his hands stretched. He was begging, and interestingly, his face was covered. And my wife got curious. She wanted to know why beggar covered his face. So she peeped inside, and the beggar was talking to somebody on the mobile phone. This is India. India, a country of great happening. All the best, and I would like to wish all the young graduates a very, very bright future. God bless. Thank you.